Hello and welcome to this week's installment of the Weekly Health Insurance News Roundup. This week we have a plethora of stories to look at. The first one is based on a study done by several Ohio doctors in which they were surveyed and asked whether they feel health insurance companies interfere with their ability to administer care, and almost unanimously all the doctors thought that health insurance interfere not only with the health care they provide, but also their prescriptions and everything else. They say it makes health care more tedious, more expensive, and more time-consuming. And I find this pretty startling and pretty disturbing myself, because it brings in the question of trust. I mean, how can we trust our doctors if we feel they're in the pockets of health insurance companies? But doctors apparently don't like it either, so it's kind of interesting. The next article has to do with researchers from the University of Minnesota saying that they feel that if Congress enacted a nationwide market for health insurance, that 12 million people at least would gain access to health care because it's cheaper across state lines. This would also go over and under a lot of mandates that a lot of states have imposed on health insurance, which the researchers say raise the cost. Another article talks about the decline of private health insurance, while enrollment in Medicare and Medicaid, which is government-funded insurance, has risen, which is interesting. Those are just three of the stories we looked at this week on the Weekly Health Insurance News Roundup. For the entire text, go to healthinsuranceonline.com. That is www.online-health-insurance.com. Thanks, and have a great week.